Hello and welcome to my channel. My name is Dr. Aisha Munk and I am a psychologist, neuroscientist and physician. Today I want to talk about a topic that affects many people but is often misunderstood: post-traumatic stress disorder or PTSD. Whether you are personally affected, know someone who is, or just want to learn more, this video will give you important insights. We will explore what PTSD is, how it differs from a normal reaction to trauma, and the typical symptoms of the disorder. I'll explain how PTSD is diagnosed and delve into the neurobiological mechanisms behind it. Most importantly, we will discuss various treatment options in detail, ranging from psychotherapy to medication and complementary approaches. What is PTSD? PTSD stands for post-traumatic stress disorder and is a serious mental health condition that can develop after experiencing or witnessing one or more traumatic events. What qualifies as a trauma? Trauma refers to events perceived as life-threatening or deeply distressing. Examples include natural disasters such as earthquakes or floods, experiences of violence, including abuse, assault, or war, accidents, for example, severe car crashes, or the sudden loss of a loved one. Important: not everyone who experiences trauma will develop PTSD. It depends on individual, biological, and social factors. How common is PTSD? Studies show that approximately 8 to 10% of people experience PTSD at some point in their lives. For individuals who have been experienced trauma, the risk is significantly higher. For example, 10 to 20% of soldiers who have been exposed to combat or other traumatic events develop PTSD later in life. What is a normal acute trauma reaction? After a traumatic event, most people experience intense emotional and physical symptoms. This is a natural response to an extraordinary stressor. These reactions are part of the body's and mind's way of adjusting to the event. Typical symptoms of an acute trauma reaction include emotional responses: fear, anger, sadness, shock, or confusion. Physical responses: rapid heartbeat, trembling, sweating, nausea. Cognitive changes: difficulty concentrating, intrusive thoughts about the event or inner restlessness. Behavioral changes: withdrawal, avoidance behaviors, or impulsive actions. These symptoms occur immediately after the event and may last for days or weeks. Generally, they subside within a month if the person receives support and processes the experience. A normal acute reaction to trauma is not considered a mental disorder and often does not require professional treatment as long as the symptoms diminish and daily life returns to normal. So when does trauma turn into PTSD? If the symptoms persist, worsen, or last for more than a month, it is classified as PTSD. These symptoms significantly interfere with the affected person's daily life. The symptoms of PTSD are divided into 4 main categories. Re-experiencing, also called intrusions. People relive the trauma repeatedly through flashbacks, nightmares, or intrusive memories. For example, a loud noise might trigger a flashback for someone who has experienced war. These episodes can feel so real that individuals feel as if the event is happening all over again. Avoidance behavior. Many people with PTSD actively avoid anything that reminds them of the trauma, such as specific places, people, or even everyday situations. For example, a person who survived a car accident might avoid highways or driving altogether. Negative changes in thinking and mood. Trauma often alters how individuals perceive themselves and the world. Common feelings include guilt, worthlessness, or emotional numbness. For example, feelings of isolation and hopelessness are widespread. Hyperarousal. Individuals with PTSD are constantly on high alert, which can manifest as sleep disturbances, irritability, difficulty concentrating, and being easily startled. Biologically, this is linked to an overactive amygdala, the brain's fear processing center. How is PTSD diagnosed? The diagnosis is based on criteria outlined in the DSM-5 or ICD-11, two international classification systems. Key criteria include the trauma must have been experienced as life-threatening or extremely distressing. Symptoms such as re-experience, avoidance, and hyperarousal must persist for longer than 1 month. There must be significant impairment in daily life, such as difficulties in relationships or at work. The diagnostic process includes clinical interviews. Psychologists and psychiatrists use standardized clinical tools such as the CAPS-5 to assess symptoms, or questionnaires. Instruments like the PCL-5 help evaluate the severity of the symptoms. PTSD is not just a psychological condition, it has also profound effects on the brain. Traumatic experiences leave lasting imprints on brain function. Amygdala. This part of the brain processes fear and threats and becomes overactive in PTSD. This leads to a constant state of hypervigilance. Hippocampus. The hippocampus, responsible for memory formation, is often smaller, as shown in MRI studies. This contributes to difficulty contextualizing traumatic memories as past events. Prefrontal cortex. This area, which regulates the amygdala, is often underactive, exacerbating fear responses. The HPA axis, the stress response system. Trauma disrupts the regulation of stress hormones like cortisol, leading to chronic stress and sleep disturbances. The treatment options for PTSD are trauma-focused cognitive behavioral therapy. The goal there is to process the trauma and develop healthier thought patterns. This often includes exposure exercises where individuals revisit the trauma in a safe environment. EMDR, eye movement desensitization and reprocessing. This method processes traumatic memories through guided eye movements. Studies show MDR is highly effective, especially for single event traumas. Narrative exposure therapy, NET, particularly effective for complex trauma, such as prolonged abuse or war experiences. It involves in creating a detailed narrative of one's life to place traumatic events into context. Antidepressants such as SSRIs, selective serotonin reuptake inhibitors, and SNRIs, selective norepinephrine reuptake inhibitors, are often prescribed alongside psychotherapy. Complementary approaches include mindfulness exercises, yoga, and meditation, and can help reduce stress. Neurofeedback is a promising approach to regulate the brain activity as well. Self-help and social support is also important. Support groups can provide a sense of community and understanding. A strong social network is often a critical factor in recovery. To sum it up, PTSD is a serious but treatable condition. Psychotherapy, medication, and complementary approaches offer hope and support. Early intervention is key to improving quality of life. If you or someone you know is struggling with PTSD, don't hesitate to seek professional help. There are many paths to recovery. Thank you for watching this video. If you found it helpful, please give it a thumbs up, subscribe to the channel, and share it to help others. See you next time.